So what's the number one benefit you're seeing your customers experience? Like they're like, hey, I plugged in, I used it, it's my first week. This is what I'm feeling. I love it. What is that typical feedback?
There's probably, three or four core benefits that
Great.
we hear back and that are also supported by probably the most science. One would be skin health. It's very, very clear that you're gonna be hard pressed to find someone that uses red and near infrared light, especially red light, on a consistent basis that where their skin doesn't look better over
Yeah,
time.
I've noticed my skin tone the last week is really
I
evened
was just
out,
gonna
like
say it
really
looks
more
good.
glowing. Yeah, it's really glowing. So I'm like,
Yeah,
okay, this is good. I'm gonna do that 5 minutes after this, 5 minutes after
yeah.
work. This is great. I like it.
Yeah, yeah. So that's one of the key benefits. And then there's a few others that really stand out too. Most people that purchase our devices that are trying to reduce pain and inflammation, that's one of they usually see pretty dramatic results. It kind of depends on how severe that pain is and whether they see like immediate results after maybe one session or if it takes 2 to 3 weeks. But the reduction of pain and inflammation is another core benefit as well that we often hear. So skin health, reduction of pain and inflammation, and then there's a few others. We have got a lot of kind of fitness enthusiasts that purchase
Hmm.
our devices too. They typically they find that they recover a lot faster after training. So they know how after doing maybe a typical HIIT workout or a CrossFit workout or something like that, they know how their body typically feels. And using red and near infrared light, especially near infrared light, they're seeing some pretty significant decreases in terms of their recovery time. So muscle recovery, that's another big one. And then there's kind of some early interesting things that we're beginning to study ourselves as a company. One of which is hormone health. That's another kind of emerging kind of benefit that we hear a lot back from customers on that have done blood work, and they're seeing these biomarker changes with respect to different hormones, and that's kind of another kind of emerging kind of health benefit that's interesting as well.
That's great. You said a couple of things I want to circle back to, but I want to just hit this off the bat because I specialize in thyroid health, and I see hundreds of patients that have autoimmune thyroid disease, like Hashimoto's, for instance. And
Mm-hmm.
I've used red light therapy where they've kind of really gotten close to the Joov device, gotten their throat right up to there. And we've seen a reduction in their antibodies and swelling and how they felt. So
Mm-hmm.
I've noticed it clinically, seeing that antibody reduction and just seeing the symptomatic improvement, swallowing tightness reduced. So I think that's phenomenal. Really cool.
Yeah, yeah, it's certainly exciting for us. And this kind of when you look at like the published peer-reviewed evidence around light therapy and hormone function, and really specifically the thyroid, there is some interesting data for sure, but it's fairly limited. But over the past 2 to 3 years, we've seen a ton of responses from our customers that have like Hashimoto's as an example, or some sort of thyroid condition, or just like guys in general that are like, man, I'm on TRT and it's not, that's the only way I can keep my testosterone up, as an example. And they're doing, pre and post blood work, before and after using, red light therapy. And so we those two things, the lack of kind of the minimal amount of existing evidence combined with like a lot of anecdotal, feedback from our customers has kind of sort of caused us to look at this even further. And in fact, we just wrapped up a clinical study with a group in Minneapolis, Bristol Cone Medical, where we actually study this. We took both male and female participants and looked at progesterone to estradiol ratios in women,
Ooh.
and then testosterone to estrogen ratios in men. And the two groups that we looked at were people that they were on a normal, kind of standard American diet and just incorporated red light therapy. And then the other group incorporated red light therapy and then also did the ketogenic diet. And so we looked at those two cohorts in this particular study. Really interesting. In fact, we're recording this here in kind of mid to late January, and one of the researchers, Dr. Kelly Gibbous, is actually going to be presenting the data at the Metabolic Health Conference here in Southern California this weekend. But really interesting
Wow.
results. Yeah, for sure. And just to kind of follow that up, the participants that ate a normal, they didn't do anything. The only thing they did differently was introduce red light therapy. So ate their kind of normal diet. They saw significant increases in both testosterone in men and progesterone in women. Really significant, statistically significant differences. But then when you looked at the group that was on a ketogenic diet and then introduced red light therapy into their daily routine, they saw phenomenal increases. It was like, it's mind blowing. I mean, we're talking about 50 to 100% changes in testosterone and progesterone So really, really compelling. It appears that there's
Wow.
definitely some metabolic synergies going on when it comes to, red light therapy and our body's ability to produce those hormones.
So what's the mechanism, right? Like I'm just trying to wrap my head around this. I'm
Mhm.
thinking, okay, well, we know red light has a major effect on inflammation. We know the more inflamed you are, the more your glandular system is kind of always hardwired to deal with stress and inflammation, overhealing, recovery, reproduction, right? These
Mhm.
hormones are all reproduction hormones, but they also help you age well, put on muscle, feel great. But the more stressed you are, the more you're going to make your anti-inflammatory stress hormones to put out the fire. So I see one possible mechanism is
Mhm.
just reducing inflammation. I see the other one is mitochondria and all these glandular tissues as well. We're enhancing mitochondrial function, which has to then, on the other side, increase glandular output. Am I kind of in the right wheelhouse there? What do you think?
That would be my hypothesis is
Mm-hmm.
is what you just recalled there, Dr. J. And that's actually what Dr. Gibbous reported back in one of her conclusions is like this ability for red and near infrared light to reduce what she referred to as metabolic congestion. So think of like cars going down a busy interstate and you got this traffic jam. And that's what kind of happens in our mitochondria, where if we're overloaded with, if our mitochondria has too many different choices when it comes to food, or too many different choices to fuel itself, there's like a log jam. Basically, you get sort of cars
Backed up.
weaving,
Mm-hmm.
yeah, backed
Yep.
up, cars kind of
Mm-hmm.
clogging, changing
Yep.
lanes. And red and near infrared light's ability to like enhance cell signaling and reduce that congestion may lead to some of these enhancements when it comes to hormone function. There's other people though that believe, with guys as an example, that that the Leydig cells in our testes that
Yep.
are responsible for producing testosterone, that
Yep.
you're helping the mitochondria and those cells function better, and a byproduct is more testosterone. I think there may be some merit to that, but I think it's actually more of a metabolic kind of mechanism. But